My name is Tina Walensky. I'm an RN at Rochester General Hospital. I'm board certified for med-surg nursing and low-risk newborn, as well as maternal newborn nursing. So during pregnancy, some issues that can happen with heroin use, opioid use, it can be a placental abruption where the placenta breaks away from the wall, which can cause a lot of bleeding. It can cause death of the mother as well as death of the baby. It can cause birth defects in the baby, such as congenital heart defects, clubfoot, spina bifida. It can also cause withdrawal in the baby after the baby is born. So babies can suffer from tremors, from seizures, from diarrhea, among many other things.
Can they die also?
Yes. Yes, babies can die from heroin and opioid use, unfortunately, especially if it's something such as a placental abruption. A lot of the times the babies do end up dying unless we catch it, unless they're at the hospital and we're able to catch it right away.
Roughly in a given day.
When we do have women coming in that are pregnant with heroin use or opioid abuse disorder, if they're already on a medication, we usually continue the medication, even past the birth. If they are not on that, then it's really up to the providers. We limit their opioid use if we can, and we also use different medications than what we would typically use with our general population. When mothers come in with opioid abuse or heroin abuse, we don't really do anything beforehand for preventative measures. It's more watching the baby after the baby is born on my side. I typically deal with the babies after they're born. So we watch them again for 24 to 48 hours. We put them on a neonatal abstinence scoring system. And we just watch them for symptoms. And if they score above a certain number, then we start to treat the withdrawal symptoms. So we've seen where somebody delivered at a corner store and came in after having used some opioids. The baby ended up living, but they ended up having a placental abruption and had to be an emergent delivery. I've seen where somebody uses cocaine or heroin and they come in and unfortunately the baby is stillborn. Sorry, I'm trying to think of some more instances for you. A lot of the times when somebody comes in for an emergent delivery like that, they'll keep them in the back. So we have a triage area and labor rooms in the back. And sometimes they tend to keep them back there because the risk of the death of the baby is so high. So they may not bring them out, into the general floor, the general population. Yeah, placental abruption is where the placenta breaks away from the uterine wall.
And the baby stops getting nutrition.
Yeah, it stops getting blood flow, oxygen, nutrition. So, the placenta basically gives the baby everything. So if mom is using cocaine, heroin, any opioid like that, it can increase her blood pressure and it can constrict her vessels, which in turn can make the vessels, make the placenta break away from the uterine wall.
And that would lower the oxygen in the baby.
Yeah, the baby gets all of its nutrients, including its oxygen, from the placenta and through the blood through the mother. And unfortunately, opioids do cross the placenta.
Okay.
One thing that the mother can experience with opioid use, heroin use, anything like that, they can experience placental abruption, which is where the placenta breaks away from the uterine wall. Opioids have a tendency to increase blood pressure by vasoconstricting, and with that, it can, again, make the placenta break away from the wall. And that's, the baby gets all of its nutrients through that placenta. Their blood flow, their oxygen, all of their nutrients, including the baby's waste, leaves throughout the placenta as well. So some symptoms that a baby can experience through the opioid use of the mother are tremors, seizures, diarrhea. They can have poor feeds. They cannot have a coordinated suck. And they have a tendency to be generally inconsolable. Again, some symptoms that babies can experience through opioid use of the mother, is tremors, seizures, diarrhea. They can have a poor coordination with their suck, so they have poor feeds, and death.
It happen also or no?
Yeah, low birth weight and cognitive problems are definitely a factor. Typically going along with the placental issues, so if there is a decrease in blood supply for the baby, I mean, because of that decrease, the baby can have what's called IUGR. It's intrauterine growth restriction. So they can be born below birth weight, or they can also be considered, depending on their size, small for gestational age, which brings up a whole other slew of problems, like glucose problems, and they can also have cognitive problems later on in life. What I would say to a mother that is having an addiction problem is just try to get the help that you need. There's lots of programs out there. If you have family, anybody, a good support system, get yourself a good support system, and do what you can to get treated. If you can, even if it means using Suboxone or Subutex or methadone to help treat your addiction, it's still better for baby to be exposed to those than it is to be exposed to heroin. Sure. So for the mothers that need help with their opioid addiction, there's a couple of medications they can take. They can take methadone or they can take Subutex. There's also Suboxone, but typically Suboxone isn't given during pregnancy due to just its classification by the FDA. Subutex and methadone are a lot safer, and you can go to a general practitioner, to your OB, to a clinic even, and they can help you with that. Some words of encouragement would just to be that, you know, it's not too late for anybody. Even if you're ready to give birth, it's not too late to protect your baby. You can always get the help that you need.